Then after vasectomy, you've done vasectomy, how will you counsel the patient? So you have to tell them that they have, like, you have to confirm that the procedure is successful. Okay, so for that you have to take a post vasectomy semen analysis. So that has to be done. This is again a question. It has to be done 12 weeks post the procedure. That is 3 months post the procedure. You have to collect the post vasectomy semen analysis sample. Okay, until then, until it is proven that there are, I'll be telling you the criteria, that the criteria for vasectomy, like the successful vasectomy is met. Till then, they have to use additional contraceptions. Okay, then and whether you should send this if you have also, like, if you have divided the vas and with the removal of small segment of the vas, then should you send the sample for histopathological analysis? This is again a question. So that is also not recommended. You need not send for histological examination of the excised portions of the vas. Post vasectomy semen analysis should be done, and additional contraception should be used until azoospermia is confirmed, and this sample is done 12 weeks post vasectomy. And if one sample has confirmed azoospermia, then you need not do another sample. So that is not required to confirm azoospermia. Then about postal semen sample, like ideally it is recommended that patient should come to the clinic and give the sample. But if the patient lives far off and is not able to come, then you can also ask them to post the semen sample. Okay, however, for in that sample, you cannot assess the motility. You can just count the number of sperms if they are there. Okay, and then what is
Case
the
only failure, right?
yes?
Okay.
Okay, vasectomy failure. How is it defined? If you find at least any motile sperm after 7 months, so that is counted as vasectomy failure, or non-motile sperms after 7 months, which are more than 1 lakh per ml. Okay, understood. So any motile sperm after 7 months or non-motile sperms after 7 months, which are more than 1 lakh per ml. Okay, so in a small portion of men, non-motile sperm will persist post vasectomy. In such cases, special clearance can be given to cease using additional contraception when they are less than 1 lakh non-motile sperms. Okay, if motile sperms are observed in a semen sample 7 months post procedure, then vasectomy should be considered as a failure. Or if more than 1 lakh sperms, non-motile sperms are observed in a fresh sample, then again 7 months after vasectomy, then again clinical judgment should be used, and centrifugation is not recommended. So ideally, like if you have done vasectomy after 3 months, that is after 12 weeks, you should get azoospermia. But in case you're not getting azoospermia, then you have to see whether you are getting motile sperms or non-motile sperms. If it is motile sperms, you'll ask them for another 4 months to use additional contraception, and after 7 months you will check again. If after 7 months also any motile sperm, or if more than 1 lakh non-motile sperms are there, then you ask them to use additional contraception. It is a vasectomy failure. Okay, understood.
Okay, ma'am.